If your legs have become weak, you have trouble getting up from a chair, or you feel your legs shaking after walking just a few steps, what I'm about to tell you might completely change everything you believe about leg strength, because there's an important truth that many doctors don't talk about. We've all heard that walking is the best way to have strong legs, but walking might not strengthen your leg muscles the way you think it does. In a study of 312 seniors over the age of 65, those who did a few simple exercises while lying down gained 38% more leg strength than those who walked. Yes, you heard that right. Those who exercised in bed became stronger than those who walked every day. But why? Because when the legs are already weak, walking alone doesn't put enough strain on them to build muscle. It only keeps the muscles at a minimal level of activity. And that's exactly why many elderly people walk for months but still feel weak. But the good news is this. There are 5 special exercises you can do while lying in bed, and these exercises activate exactly those muscle fibers that are less engaged during walking. And exercise number 1, which we'll introduce at the end of the video, has shown results in some clinical studies that are comparable to walking thousands of steps in terms of increasing muscle strength. So stay with us until the end to find out which movement you should do tonight before bed to regain the lost strength in your legs. In 5th place is the ankle pump exercise. It may seem simple, but it's one of the most important exercises on this list. All you need to do is lie on your back and gently move your toes forward and then toward your face. You might be wondering what benefits such a simple movement could have. But don't rush, because this exercise is the foundation for the rest, and many seniors don't get the results they want precisely because they overlook it. When you sit or lie down for hours, blood pools in the lower part of your legs, and the calf muscles, which act like a natural pump, become less active. The result? Heavy, weak, tingling, and fatigued legs. To do this exercise, lie on your back and keep your legs straight. Point your toes forward and hold for 2 seconds, then pull your toes back toward your face and hold again for 2 seconds. That's 1 repetition. Perform the movement slowly and in a controlled manner. The slower you perform the movement, the more your calf muscles will be engaged. Do 15 to 20 repetitions and repeat this exercise 3 times a day, in the morning, in the evening, and before bed. This exercise is especially beneficial for people who sit a lot, have recently had surgery, or experience ankle swelling. Just be mindful of these 3 common mistakes. Do not perform the movement quickly. Complete the full range of motion and don't hold your breath. For better results, contract your calf muscles as you point your toes forward. This small change can multiply the effectiveness of the exercise. Many seniors feel that after a few days, their legs become lighter, warmer, and more energetic, and as blood circulation improves, all subsequent exercises become more effective as well. Before we continue, if you enjoy these types of videos, be sure to subscribe to the channel and turn on the notification bell so you don't miss any new videos. And if you'd like to support the creation of this content, you can use the Super Thanks option. Your support helps me create more and better videos for you. Now we come to number 4. The heel slide exercise is a simple, yet remarkably effective movement that helps to strengthen your hip and knee muscles, all without even needing to get out of your comfortable bed. This exercise specifically targets the muscles you need every day for getting up from a chair, climbing stairs, or getting out of a car. In a study on the elderly, those who performed this exercise for just 10 minutes a day showed much better ability to get up from a chair after a few weeks. To do this exercise, lie on your back and keep your legs straight. Now, without lifting your heel off the bed, slowly slide one heel toward your buttocks. Continue as far as you feel comfortable. Pause for 3 seconds, then slowly return to the starting position. This counts as 1 repetition. Do 10 to 12 repetitions for each leg and repeat this exercise once or twice a day. This exercise is especially helpful for people who have difficulty getting up from a chair. They feel like their knees give out when walking, or their knees have become weak after a period of illness and inactivity. It's also a very good option for people with arthritis because it moves the knee joint without putting too much pressure on it. However, to get the best results, you need to avoid some common mistakes. First, your heel should not lift off the bed. The entire movement should be done by sliding on the bed. Second, don't rush. If you move too quickly, your muscles will be less engaged. The movement should be slow and controlled, both when bending your leg and when returning it. And third, don't forget to breathe. As you slowly pull your heel toward yourself, make sure to exhale deeply, and then inhale as you return your leg back to the starting position. For greater effect, try to contract your front thigh muscle at the same time. This small change will activate more muscles and improve your training results. Many seniors feel that after just a few weeks of regular exercise, they have better balance when walking and their legs feel lighter and stronger. And now we come to number 3. One of the best leg strengthening exercises for seniors. The straight leg raise is one of the most well-known physiotherapy exercises, which strengthens the front thigh muscles and hip flexors. The reason for its importance is quite clear. The front thigh muscles play a key role in walking, standing, and preventing falls. When these muscles become weak, the knees become unstable, balance decreases, and getting up from a chair becomes harder than before. In a study on elderly people with weak knees, just 5 minutes of daily exercise for 12 weeks led to more than a 40% increase in thigh muscle strength and a significant improvement in walking speed. To do this exercise, lie on your back, bend one knee, and place the sole of your foot on the bed. The other leg should be completely straight. Before lifting your leg, tighten the front thigh muscle. It's as if you want to pull your kneecap toward your pelvis. Then slowly lift the straight leg about 30 centimeters off the bed, hold it for 5 seconds, and then lower it back down over 3 to 4 seconds. Do 8 to 10 repetitions for each leg, and at first, once a day is enough. This exercise is extremely beneficial for people whose knees give out when walking, who have to use their hands to get up from a chair, or who feel shaky when going downstairs. Just be careful about a few common mistakes. The knee should not bend. Do not lift your leg too high, and avoid using momentum in the movement. The movement should be completely slow and controlled. For better results, while holding your leg in the air, count out loud to 5 and press your lower back slightly against the bed so that your core muscles are also engaged. Many seniors say that after a few weeks of regular exercise, they feel stronger and more confident when going upstairs again. Now we move on to number 2, an exercise that many people underestimate. The glute bridge is one of the best exercises for activating the glute muscles. These muscles are actually considered the main engine of the lower half of the body. When the glute muscles are weak, more pressure is put on the knees, hips, and lower back. But when they're strong, walking becomes easier, getting up from a chair is simpler, and your balance improves. In a study on seniors over 70 years old, doing this exercise just 3 times a week for 10 weeks reduced the risk of falling by more than 50%. To do it, lie on your back, bend your knees, and place the soles of your feet on the bed. Then press your heels into the bed. Tighten your glute muscles and slowly lift your pelvis until your body is almost in a straight line from your knees to your shoulders. Hold for 5 seconds, then slowly lower yourself back down. Doing 10 to 12 repetitions in 2 sets is perfectly suitable for starting out. This exercise is extremely effective for those who feel hip weakness while walking, suffer from back pain, or have trouble getting up from a chair or toilet. Just remember, the main pressure should be on your glute muscles, not your back. Also, your knees should not turn inward or outward. For better results, put more pressure on your heels than on your toes, and before lowering yourself, contract your glute muscles tightly once more. Many seniors notice after a few weeks that getting up from a chair or toilet has become much easier than before. And now, the most important exercise on this list. Number 1. Quadriceps contraction, or quad set. An incredibly simple yet very powerful exercise. In this exercise, the joint doesn't move at all. You just contract the front thigh muscle as much as possible. Studies have shown that this exercise can actually be more effective than walking for strengthening weak leg muscles. To do it, lie on your back and keep your legs straight. Press the back of your knee firmly against the bed, as if you're trying to crush something under your knee. At the same time, fully tighten your front thigh muscle and hold this contraction for 10 seconds. Then rest for 5 seconds and repeat. Do 10 repetitions for each leg and perform this exercise twice a day in the morning and evening. This exercise is one of the best choices for seniors whose legs have become very weak, people who have been bedridden for a while, are recovering from surgery, or feel unstable when standing. But don't forget a few common mistakes. Weak pressure leads to weak results. The contraction should be as strong as possible. Hold the movement for no less than 10 seconds and be sure to completely relax the muscle between repetitions. For greater effect, simultaneously pull your toes toward your face and count out loud to 10 while holding the contraction. Many elderly people say that after just a few weeks of regular exercise, they can once again stand up from a chair without using their hands and feel more stable when walking. So these were 5 simple yet effective exercises that can help strengthen weak legs. You don't need to start all of them today. Even if you choose just one exercise, start with the quad set and gradually add the other exercises as well. Remember, at this age, consistency is more important than intensity. A few minutes of exercise every day is much more valuable than doing intense workouts occasionally. If you found this video helpful, be sure to like it, share it with your friends, and follow the channel. And now tell us, which of these 5 exercises will you try first? Thank you for staying with us until the end. Until the next video, stay healthy, energetic, and strong.